the vulnerable. Get on with it.
I call the member for Goldstein.
Thank you, Deputy Speaker. And Deputy Speaker, as a Victorian, I'm proud to contribute to this debate because it goes to the heart of the confidence the Australian people and, critically at this time, the people of Victoria need to have in their vaccine system. And the tragedy is that the cheap politics of the opposition, and it's not cheap. That's unkind. I withdraw. It's well beyond cheap. It's bargain basement, derisory politics, which does nothing to advance the sense of confidence that Victorians need right now. Because when they look at this chamber, what they should actually see is their parliament backing the people of Victoria and supporting them. And that is what the Morrison government is doing. And if the Labor Party found a way to rise above it, they will come and continue to support the efforts that have been made by this government, by state governments, to make sure we can address the risks of this virus. I know on the 30th of March, in the Goldstein electorate, I visited the Bluff Road Medical Clinic with the Health Minister who, during one of the earliest stages of the vaccine rollout, where we saw local residents who were taking the opportunity to be able to get a vaccine. And that was in the early days when there were only about 1,000 clinics that were part of the build-up of the vaccination rollout. It was the start on the precipice or the tipping point where it went up to 4,000 by the end of that week. But what we saw were Australians who wanted to get vaccinated, GPs that wanted to deliver it, and local health services working with state and federal governments to deliver the vaccine rollout. And they did so because they understand how critical it is to getting Australia back on its feet. And thankfully, following that, the state governments rolled out major super sites where people could get vaccinated, not just through local GP centres. But it's very disappointing because we know, for instance, just yesterday, as we knew we were on the precipice of a very serious potential outbreak in Victoria, people went to the Royal Exhibition Centre in Melbourne, which is a site managed by the Victorian State Government, and at 4:30 in the afternoon, they were turned away. So there is definitely some improvement on some parts of the vaccine rollout. I agree. No one should kid themselves. When office city workers are leaving their offices at the end of the working day and going to state government vaccine sites and they're not getting admitted and nobody is there to support them, it kind of suggests there's room for improvement. And we work with those governments to seek improvement. Like we continue to work on improving the hotel quarantine system, like we doubled the size of the Howard Springs facility to enable more Australians to return back into our country, in the same way that we're looking very confidently at the proposal put forward by the Victorian government as well. But of course, what it requires is understanding the nature of the virus. There's a reason why our hotel quarantine system has almost perfect efficacy, and is because it's a system designed to understand and work collaboratively with the states,
you don't want to
with
be
the
kicked out under
Commonwealth,
94A.
across facilities to bring as many Australians home. Now, of course, there will still be problems that have been experienced elsewhere, and now it's up to us and our sense of responsibility to make sure we get it right. Vaccinate, manage quarantine, and hopefully get Australia back to a position where we can avoid the spread of the transmission of the virus. But let's not forget, Deputy Speaker, that amongst the tin politics of the opposition at the moment, there are Victorians facing really difficult challenges and choices. 7 days is not a short period of time. Many people have the scars of the long-term lockdown throughout last year for up to 3 months under the long Victorian lockdown. And what I want to do is a big shout-out to all those people who are going to support us Victorians at this critical time. The nurses and the doctors that provide the vaccines if people go and get vaccinated, and we should encourage them to do so. To the parents and the teachers critically who are assisting children who are being educated from home. Many of them faced a very difficult circumstance while juggling work and other personal arrangements last year, and now you're being called to do it again. And we say thank you. And to everybody else who's providing critical services at this time, we say thank you. But to the people we say thank you the most is those who take the responsibility to protect themselves and their community in getting vaccinated. Thank you.